Good evening, everybody. It is Monday and the 5th of June. Hope you had a good weekend. We didn't have a particular topic for tonight when we started, but right before the webinar, uh, someone on the listserv, Temperance, indicated, asked a question about, the training efficiency score. And I gave her a quick response. And then when Aaron saw that, he said, maybe that's a good topic for tonight as well. So we're going to start off with looking at training efficiency, that score. If people have other questions about, the activation or asymmetry scores or EMG, anything with, the training aspect and those numbers on that lower bar there, always feel free to ask those. So we're going to get folks unmuted, and once we get people unmuted, Aaron will start. He's already got, as you can see, he's already got his screen up and running, and we'll demonstrate some things about training efficiency. We got everybody unmuted, Aaron?
Yep, everybody is unmuted. So if anybody's got initial questions, feel free to speak up. This is going to take a minute or two here before it gets through a baseline anyways, before we start populating training efficiency.
Oh, Aaron, this is Hannah. I have a question, but it's not related to this particular screen. May I still ask or wait?
No, you're good.
Okay, it is related to mapping. Whenever I map, I always turn on the artifact on button so so that will minimize the potentially useless artifact. But when I'm reading the map, sometimes it shows artifact in the beta, and I'm dumbfounded. If I have that artifact button on, how could it still say that I have artifact?
Have you seen that recently, or was that more maybe 3-4 weeks ago?
Oh, just today. I just did one today, yeah.
I can check in with our development team. It shouldn't be showing that once you upload. Unless by chance you grabbed the second file instead of the top file. Because generally, if you're getting the artifacts showing up in the map, it's due to the fact that it's most time it's picking up elevated beta, which would be muscle tension. So I would just verify two, because you are getting the 2 files per recording.
Yeah, which one should I pick? Pick the one without artifact or with artifact?
So it's always going to be the top file. So the very first file for, let's say, eyes closed will be the clean file with all the artifact removed. The second file below that will say with artifact, and that's everything. So it's always going to be the top eyes closed and the top eyes open is what you're going to want to get. If it says like with in the file name, then that's the bad file. If you were going to pick that file, you would have to run that through the EEG editing tool first and hand artifact it. So that's what we would do if you had a kiddo that you couldn't leave the auto artifacting on, so moving too much, or even an adult maybe with a tremor issue. Then we'd grab that second file, but we'd import that into the EEG edit tool first and clean it up. And then we'd have to upload it as a CSV file. So if you've never had to do that before, feel free to reach out to me and I can help walk you through that.
Oh, thank you so much. Thank you. No further question. Thank you.
You're welcome, Hannah.
All right. Well, now we got a training efficiency score.
Yes, we do. All right. So the question on the listserv this morning was about, the question was specifically around training asymmetry with the standard like protocol 18 or 20 that we use for that. And the question was about having low training efficiency on those protocols, specifically like training F3, F4, and O1, O2, if my memory serves me correct. So a couple things to always factor in. The training efficiency before we start adjusting target percents here. So if I'm training alpha or beta asymmetry, I'm getting a really low training efficiency. The first thing I'm going to want to do is rule out artifact. So the last couple webinars since Dr. Suter's been on vacation, artifacts been kind of getting thrown in. We've been talking about it. So always keep in mind your high beta of where that's at in relationship to everything else. So with this simulated recording, we can see we're running an average amplitude of right around 3.5 to 4 microvolts of high beta, which is fine. We see the betas right around that same area. EMG numbers are really low, so at this point we can kind of rule out, if this was our client, that there's really no artifact that is playing into this training efficiency and skewing the number. On the other hand, let's say hypothetically, we're getting a low training efficiency here. Let's say a 5 or a 6. If I notice my high beta is quite elevated, if I see it up 8, 9 microvolts, I'm also probably going to see EMG numbers are rather high. And when people start getting that muscle tension, that high beta starts coming up, if you watch your trend lines, generally what you're going to see is this beta is going to follow with it, which is really going to play around with these thresholds, because especially like the 15 to 30 down, if they've got a lot of tension, that threshold is going to be way up here. Now, mind you, this one's going to be way up here too, and actually be in a positive range in green, but that's still going to kind of mess with this, because it's going to drop their success percentage, which is kind of all what factors into this training efficiency. So we have to first understand that this training efficiency, it's a ratio. There's a bunch of different little components on this training screen that are all getting kind of added together to come up with this. And we should also talk about what are some normal ranges that we should be seeing, depending on whether or not we're running a 1-channel, 2-channel, or 4-channel protocol, because our average range is going to be very different depending on how many thresholds we're running.
Yeah. And just to add to that, one of the things to think about in terms of why that is what you're looking at that Aaron has up here is a 2-channel training with 1 up and 1 down on each channel. That's 4 variables that are contributing to the training. Now, if Aaron added a high beta stop, for example, on both sides, then all of a sudden you've got 6 variables. So the reason I'm mentioning that is when you're doing a single channel training, if you were just doing straight SMR up, that's 1 variable that you're dealing with for the whole session, versus SMR with something down, like maybe a 2 to 4 down, or a 2 to 4 down, and then maybe a high beta stop as well down. Then you'd have 3 variables, as opposed to a 4-channel training where the minimal values would be 8. What you have is 4 here, and if it's a 4-channel training, you have 8 variables, and if you start adding high beta stops, then you've got 12 variables. So that's one of the reasons that efficiency goes off, just for those that haven't looked at it from that perspective. Go ahead, Aaron.
Yeah, and like Rob's saying, so if we're running, let's say, a standard starting point, a lot of us might choose to use, and that would be, let's say, a 1-channel SMR at CZ to start working on any sleep issues. With a protocol like that, seeing a training efficiency of like 100 to 120 is not
very common. Yep, very common. It's almost always going to be over 50 or 60. Almost always going to be over 50 or 60. And just again, if you didn't mention, I didn't hear you mention it, when you're doing a 2-channel training, the range we want to see that number in that training efficiency is 5.0 to 30.0. That's a good range to be in. So this one is within range, but if you want it to be a little bit better, well, we're going to tell you about that. Go ahead.
Yep. And just to finish that off, so like Rob said, up around 30 would be the upper end on a 2-channel. On a 4-channel, a really good training efficiency is only going to be a 5 or a 6, just
Yep.
because doubling the complexity going from a 2 to a 4. So that training efficiencies, normal training efficiency is going to be a lot lower.
Yeah, if they can keep a 5 or a 6 going, that's a good. That's a good.
Yeah, 4. So you can see here, I've got all the target percent set at 85. Right. So this is Rob, and Rob mentioned this the last time him and I did a webinar, and we were kind of talking about training efficiency and target percentages. And Rob shared with everyone that he likes to start all new clients at 85. Now, keep in mind when you create a new training plan, the software by default is going to set the target percent at 75. So you will need to change that as you're designing the training plan. And I loved his reasoning for it, because a lot of us already know that around the first 3 sessions with a new client, their brain's in this huge learning phase. No one's brain understands what we're asking it to do initially. So it takes generally 2-3 sessions before their brain really grasps the concept of what it's supposed to be doing.
Yep.
So Rob's theory in setting them at 85 is so the brain feels successful. And I when he said that, it just clicked and made perfect sense to me. Of giving them that chance is no different than training a puppy or having a young child. We need to be a little bit easier with them initially till they kind of learn what they're supposed to be doing, and then we can try to challenge them a little bit further. So Rob, what was it like on the 4th session? Then you start moving them down.
Yeah. What I'm also looking at, because you were pointing towards those targets at 85, and notice on channel 1 there, the first variable, the 2 to 12, which is a hard one, was below 85. It was at 81 not too long ago. And then on channel 2, we got everything is at 92%. Once I start seeing the success, what you're going for is you want that success number to be equal to or greater than your target. And of course, it's going to vary, as you've seen. Now we just saw, it went up to 89 on channel 1. But before that, we had some numbers down in the 70s. Once I see consistency, like in the 90s, where it's definitely staying over that 85%, that's when I take it down to like 80. And then that makes it a little bit harder for them. And you'll see that training efficiency number will go down. But as they get used to that training method, and they adapt to it, then that number begins to go up again, and then I'll take them down to 75. But what I'm trying to do is build success. One of the things I don't say here often, and now notice on channel 1, I think it went down to 82. So that's normal. That's just a little bit below the 85. Now it went down to 75. But as long as it doesn't stay there is what we're looking at. Because what you're seeing, these ranges going back and forth, that's really normal stuff. What I've said a few times maybe here is, and this is my method, folks. This is not the way. It's my way. It's a way. It's my bias. I tell people when I mentor them that I expect a client to tell me they've noticed some benefit from a session after 4 or 5 sessions. And if they don't mention any benefit, then we're going to change the protocol and run it another protocol, 4 or 5 sessions. And if after 10 sessions they say, I'm not feeling anything, then we're going to sit down and talk about what it is going on in their lives that's causing them not to respond well to neurofeedback. Now, somebody with a severe head injury, that'd be a different ballgame. But for your average person coming in for depression, anxiety, poor sleep, that's sort of the rule that I tell them. But as a clinician, between me and the group here, I expect to hear that they've made some benefit after 1 or 2 sessions. And that's one of the reasons I like to keep that training ratio up there at 85, Aaron, is because I will email that person. I tell them I want you to pay attention today after your first session. I say to them, please pay attention to how you do. Do you feel a little more energy? Do you feel a little bit better focus tonight? Do you feel a little more sleepy? If you get sleepy before your bedtime, don't fight it. Go to sleep. That's okay. And then I'll email them the next day and ask how they do. And what I expect to hear after the first or second session, they've noticed some benefit. It never lasts long. It lasts for the day, and then it's gone the next day. Or in some cases, do note, some cases people don't know the benefit the first day. The second day is when it kicks in after the session. But that's what I'm using as a gauge in terms of working with them and protocols and success rates, if that helps.
And like Robin mentioned in there, about I always train people not to make knee-jerk reactions on these numbers.
Right.
Because artifact, like we can see, it's in this particular recording, we see how delta just keeps kind of weaning and waning through the whole session. And as that happens, now you can see as delta is kind of calming down, now we can see, especially over here on the 2 to 12 down, we're back up to a 92% success rate.
Yep.
So this particular client, when this recording was done, their delta just kept having this surge in power, which, every time that power surges, it's going to push this threshold way up over the threshold line. And the longer it stays up there, the lower the success percent's going to go. So kind of watch your trends, in conjunction with what's going on. So if you're seeing this kind of wee and wane, especially in the delta, and you're seeing this success percentage kind of going all over the place, just know that that's kind of what's going on. And we'll even see that a lot of times with new clients, where nothing's really staying stable like we see with theta or alpha. It's kind of, especially delta, will be all over the place. But let's say, and this kind of going back to Temperance's question, let's say, we had only a training efficiency of 4 here, and we're running our target percents at 85. Then what I might want to do is start increasing these target percents. Now, keep in mind, 90 is your upper end here.
Yeah.
You get over 90%, you're making it way too easy. And the brain doesn't have a reason to need to change for anything. Kind of on the opposite side of the scale, I've trained down as low as 65 on clients. But I can say those clients were more, I would probably put them closer to a peak performer category that just had some basic issues. And the harder I made the session, the more like a peak performer's brain will be challenged, which sometimes they need that. Whereas just the opposite, anytime I had a real elderly patient, especially, 80 and over, I generally knew that I was probably going to be even starting my target up around 90, just because their brain tend to be more tired, potentials for more rigidity. So I'm just trying to kind of gauge target percent off age, thinking health, so if I get, let's say we have a client who's middle 30s, good solid diet, something maybe Yannick would recommend they eat and supplements, they're exercising 3-4 days a week, their target percent, I'm probably going to be able to, more than likely, I'm going to be able to push them a little bit harder, just because there isn't all those other issues in the way. And we can see here again, it did peak and come down. So again, let's say I've got a training efficiency really low. What I'm going to do to adjust these target percents is we're going to come down to this filter options button here. So it's a little gear button underneath where it says auto on everything. And the only thing we want to adjust is the very top number here. So these are our training frequencies. We don't want to adjust those, but let's just say I want to try to increase this training efficiency. So if I went up to 90, let's say on all of them, Now keep in mind, you are going to need to let this run for at least a couple minutes before you start seeing any change in this training efficiency. Now, pretty quick though, the fact that I increased the target percent to 90 at the upper end of our limit to make it easier, pretty quick, we should probably see the success percent start to increase above where they're at now. And as those success percentages increase, the training efficiency should start to increase as well. So that's one way of kind of improving it. And, you know, Rob made a comment the last time we talked about this too, is let's go to the opposite side of all of this. Instead of talking about real low training efficiencies, let's talk about really high training efficiencies. So let's say you've got your client, you're starting at maybe 85 across the board, and 10 minutes into their first session, you've got a training efficiency of 50. You know, their success percentages are all like 95 to 100. You know, again, that's too easy. You know, so you can be too low on training efficiency, and you can also be too high. So it's trying to keep them in that sweet spot. So if you had a really high training efficiency, like 45 or 50 on, keep in mind that's on a 2-channel with 4 thresholds, you know, then I would want to lower these down. And I always just go, with me personally, I go in 5% increments. And then I wait 2 to 5 minutes to see how all that averages out. And we can already see we're creeping up. You know, we were down at 10.3, we're up to 10.6. Now, mind you, there's a lot of data here averaging into this. You know, so this is the whole session's training efficiency. So the fact that I made this,
it's also a simulation, folks, and that's one of the reasons this number is not going to go up way high. Even if you keep it at 90, it's never going to go up to like 30 or better because it's a simulation. There's no real data going into it, you know, from a brain.
Don't have a human being there to do all this. And to help everyone kind of, for those of you that really don't understand what this percentage is doing as we increase it and decrease it, the best way I've had to explain this is I think of this target percent like brakes on a vehicle. And the higher the percentage, the less brakes we have on this little threshold bar. So with the target percent right now set at 90, what that's doing is removing a bunch of the brakes off of this. So as the client's brain activity moves around, in this case at 90, it's going to allow this threshold to be pushed up higher. And you can see it went from 2.22 to 2.34. And as this mid beta here keeps surging with a higher number, it's going to keep allowing this to push up higher and higher. And that's what's making it easier for the client.
But afterwards, I mean, we're not meeting again until August. Well, the super.
Okay, sorry about that. Now just the opposite. You know, if we drop this target percent down to 75, now it's like you're coming to a stop sign in your vehicle. You're putting heavier brakes down, which is going to keep this threshold planted more, which is going to train them harder because it's not, you're basically not giving in. It's kind of like, think about parenting a difficult child. You know, 90 is let the kid do whatever it wants to do. 75 is now we've got some rules and we're not going to get pushed around. And like Rob said, you have to kind of watch that success percentage because, you know, you don't want to drop them to 75 and then see them at a success percentage of 50. You know, that's kind of defeating the purpose here. We don't want their brains to be that exhausted at the end of a session. You know, and if you would train somebody with only a 50% success rate for the whole 30 minutes, there's that really good chance that that's that client that's going to be calling you, you know, later that day or the next day going, wow, you know, is it normal that I was exhausted for 4 or 5 hours or I had to take a 2 or 3 hour nap? just to function. That's somebody that we just exceeded their capacity, by training them too hard. So it's kind of finding that sweet spot of.
Yeah. And that's why I think you also want to keep an eye on those thermometers and seeing that in this case, you've got, 2 channels, 4 variables. How often do you see everything being green? When all those thermometers are green, that's when the reward occurs. So if you were doing, for example, an eyes closed training, that's when they're going to hear the tone. If you're doing an eyes open training and everything is green, that screen's going to be staying pretty bright. The more green you see with all 4 of those thermometers being green. The more red you see, that means they're not making threshold, and it's more challenging. So you want to keep an eye on that as well. Because in general, and again, this is a general statement, it varies between patients and certainly with software and protocols, but you're looking to get hopefully 1 reward a second. That's what we're hoping to get. That's a good average.
Now, kind of one of the question that was brought up on the listserv too was about, protocol 18 and 20 specifically, or our true asymmetry protocols. And I have noticed over the years that some people can tend to get stuck on those protocols. And maybe you'll see the beta asymmetry good, but the alpha is having a hard time moving up to a value above 1. And we're going to talk about this on Wednesday in detail, which is photic entrainment. The last company I worked at, I had a lot of tech calls of people with just that question of, hey, I've been trying to, I'm training somebody with depression. I'm using a protocol 18. I started up at F3, F4. Their beta asymmetry is great, which we kind of expected because we saw that in the map. But, I'm 3-4 sessions in, and I haven't seen the alpha asymmetry even move, a microvolt in a positive direction. And that's when I would suggest that they added in photic entrainment to try to see if by stimulating 10 hertz that we can kind of lift the brain, give it a little bit of a help to try to push it into the proper range. And a lot of the times, I'd probably say 80% of the times I made that suggestion, I would get an email back saying, oh my God, yep, very first session that we added photic, their alpha asymmetry moved where we wanted it to go. So it just kind of really reinforces the power of photic and what it can do for us, in helping the brain achieve these goals. So that's something else you can try to add in. If you're seeing people are getting stuck, is put photic in and see if that can help kind of get them to move around a little bit more. So somebody is asking.
I use photic quite a bit, Aaron, too. You may have heard me say this too. Once Newmind had the photic glasses and the photic settings, unless they had a seizure disorder or they had really sensitivity to photic for just flashing lights in general, just didn't like it. I used it with everybody, and it really helps enhance your session. So I always found it quite beneficial.
Mm-hmm. And somebody was asking about, this target percent and other software. Yes, most manufacturers I've seen will have something in there. So if you're not using the Newmind software, maybe you're just using Newmind maps for processing and using another manufacturer's software, there's always something in there. And it might not be labeled the same, but you'll generally see it. In BioExplore, there's simply a number underneath the threshold. It doesn't have a success percent, but the number that's below the threshold, like in BioExplore, that is that target percent. And it's the same way, same ranges. You don't want to go above 90, generally on the low sides, around 70 or 75. I can't speak on behalf of BrainMaster, I've never had the opportunity to use their software. So, but I can imagine Tom Kalura built that in.
They did, and I think if my memory serves, well, it's been quite a few years since I've done it, but its target was typically 60.
Okay.
I
So
think.
there's
Don't quote me on it.
okay. So they might just be a little different on their numbers, but it's generally built in because we always need a way to control, how easy or how hard a session is. But we can see even just in that little bit of extra time we ran, bumping them up to 90, we can see that had a positive impact. We were down at 10, we're up to 12 now. So it's moving in the right direction. If I would have made that adjustment to 90 back, around the 5-minute mark, we would expect to see this a lot higher by the end of the session. But if you're making your adjustments, at the 25-minute mark, don't expect to see this jump to 20. But the nice thing, the way the developers designed the software, is these target percents get saved into the configuration file for this particular training plan. So if you spend, an entire session making adjustments and getting your client right into that sweet zone, the next time you load their session up, whatever these numbers were, if you had them all set differently, which you can do that as well, they don't all have to be equal. It'll remember whatever those are. So keep that in mind as well, that you won't have to reinvent the wheel all the time. And with the higher target percent, we can see now we're way up in most of these, we're in the upper 90s, minus our low beta over here. It's hanging out at 86, but all still pretty good. Any questions on success percent, target percent, anything else you see on this screen that's maybe confusing? Something you look at every day that you have no idea what you should be seeing? Well, I guess we could kind of talk about some of the other stuff
I can't
here.
see the attendees. If Temperance is here, did we answer her question? Would be my
sorry, Rob.
question. I can't. Yeah, I couldn't see who's here.
There you go.
Oh, okay. Is she here?
Yes, she was.
All right. Well,
Looks like she
came
might
and
have
left,
gone.
huh? Okay. Yeah. All right. At any rate, hopefully we got her question answered.
So let's just, I guess, since we've been talking about these other numbers, I don't think there's really much more to really talk about as far as training efficiency or target percent. I'll just bring up activation because that's something that confuses a lot of people.
Mm-hmm.
So first of all, for those of you that weren't aware of this, any one of these numbers at the bottom of the screen, if you just put the cursor on it, you'll see it kind of changes to a little pointed finger, at least on my computer. If you click on it, it will give you an explanation of what that number is representing. So here we see the activation just reflects a ratio of slow to fast wave in the brain. So really in a textbook term, you can kind of think of this like theta to beta ratio. We call it activation because Dr. Suter wanted this number to represent a relationship of slow wave to fast wave. Well, we can't say slow wave and only talk about theta. We have to add delta into that equation. So that's what this number is telling us, is the ratio between delta and theta to beta. And our sweet spot here is between 2 and 3. And if we look at the activation graph here, we can see that. So 2 is our bottom end, 3 is our upper end. And we can see this client's been, kind of just staying, this recording, I should say, has been staying right in that sweet spot. Now, if the line goes above 3, that is indicating that your client is in a state of underarousal, which would mean excessive delta and theta. So if you've got a kid with attention issues that you're training, it wouldn't be unheard of to see them potentially above 3 when you start training them, especially if you saw a lot of excessive delta and theta in their map, especially eyes open if that's the way you're training them. Using something like, our protocol 2 or protocol 4 that's bringing that slow wave frequency down over time, if the brain's responding properly, we should see them drift into this sweet spot. Now, on the opposite side of that, and I had a couple calls even the last 2 weeks about this, is people that their clients have really low activation numbers. So they're hitting like down close to 1, or even in some cases below 1. So if you're under a value of 2, that's a brain in a state of overarousal. So if you were to look at their trend graph, you might see relatively normal delta and theta, but beta is elevated quite a bit. So where we generally say eyes open beta should be 5 or 6 microvolts plus or minus 2, they might be in that way in that upper range. Now, if the numbers are low, below a value of 1, so your white lines down here, first thing I'm going to want to look at is what's my EMG numbers doing? Because values of especially a 1 or less are generally indicative of somebody that's creating a bunch of artifact. So they're clenching their teeth. It would have to be like a contracted muscle tension. So teeth gritting. If it's back in the occipitals, we talked about that last couple of webinars of where the tendons of the neck muscles terminate on the occipital ridge. If those are tight and pulling and we're trying to train right above there, you could be picking up muscle tension there. If you're up in the frontal area, maybe their forehead's furled up a little bit. So before I jump to conclusions of, something's really wrong, with their brain activity, I'm going to be looking at my trend lines. I'm going to want to see where high beta's at. If high beta's up, especially if it's over 10, then we know it's just artifact. If you've been listening the last few webinars, we've kind of been talking about that quite a bit, that our brains are not capable of producing more than 10 microvolts of high beta. So if you saw high beta up at 10, 11, 12, and their activation numbers are 0.8, it's the artifact that's distorting that, because the high beta is generally going to drag the mid beta up, which will definitely distort your numbers. So you're really kind of looking for that sweet spot. Now, if you are training just asymmetry, protocol 18 or 20, I wouldn't expect these to really change at all. You are moving some beta up, you're moving some beta down, but you're not doing anything to the delta or theta. So you're not going to see a lot of movement in the activation if you're just training asymmetry. Or if you're just doing a 1-channel SMR protocol. I think if you're doing a 1-channel SMR, I think we have that in activation still in there for a 1-channel. We do take the asymmetry out, of course, because that's not something we should be looking at because we're training midline generally. So if you're training a protocol that's bringing delta and theta down, that's when I'm really kind of looking at these activations. To see kind of what's going on with the protocol. Is the protocol being effective? Or is everything being stagnant? And I think Rob touched on that earlier. And that's one mistake I've seen clinics make throughout the years is they look at the 2 recommended protocols. They pick the one they want to use, and then they get stuck on it. And I've seen clinics that run 20 or 30 sessions of the same protocol in the same location, and then they call and they say, hey, I've been working with this patient, but they're saying they're not getting any change in symptom. We're not even seeing any change in the progress tracker. And it's because that area of the brain more than likely wasn't ready to respond yet. So just kind of keep that in mind as you're looking at all these numbers, or if you're looking session to session, maybe in the trend history, if we're bringing delta and theta down, let's say, in the first 3 to 5 sessions, you should see at least a bare minimum of a microvolt or 2 change, especially in your slow waves, delta and thetas. That is, if you are using a protocol that's going to adjust them. So let's set that up and say we're going to use a protocol 4. We're bringing delta and theta down with a new client. You're putting the sensors at F3, F4, and we start training them. And maybe 4 sessions in, I'm still seeing this, on this left side delta staying right in the 9.5 range, or maybe theta staying right at the 6 range, and I'm 4 or 5 sessions in, and I'm still, the client's brain's still stuck there. The EMG numbers have all been good. Everything else is looking fine. We know our connections are good. It's at that point, if I had gotten through 5 sessions with absolutely no change, I'm going to be considering, what's the other available protocol here, and maybe we try that. So just kind of saying that, don't get stuck, on one spot and assume that if you run 15 or 20 more sessions that things will change. And the same applies if you're training asymmetry. So if you notice that a client, you've made some adjustments, you've adjusted target percent, maybe you've even added in photic, and you're still not seeing any change, it's at that point I would move to another section. Move back to the next set of locations you wanted to train on them, and then see if you can get some response. Something I learned from Dr. Suter years ago is that, kind of one of the things that can keep people from training is just simply their brain and other networks. That there might be another area of the brain that's kind of holding the works up. So we don't want to just get fixated, and stuck on one site, and try to beat it in a submission. Brain's going to change when it wants to change. So if it's not moving, move to a different protocol. Make a note of that in your charts. And you can always come back and train it later. But just keep that in mind. And there's so many other variables that can keep people from training. I mean, toxic stress, food sensitivities, heavy metals, sleep. We can probably add quite a few more to that list as well. But that is one of the things that we're not in control of, is their brain has to be willing to move, and if that area is stuck, it's just better off to leave it alone for for a minute or two, go train somewhere else, and when you come back around, hopefully the next time, maybe you've cleaned up whatever was holding it up the first time, and now they're ready to start training.
I want to make one more comment about asymmetry. When you're training on 2 channels like this, there are protocols that you can use that are just midline protocols. You can train, for example, FZ and CZ simultaneously, and I do that quite a bit. And if you're doing that, remember, then you're on the midline, so those asymmetry numbers have no relevance to anything. Whatever they're reading, just ignore them, because there's no asymmetry there. You're on the midline, just like doing a single channel training.
Good comment, Rob. I guess we can, any other questions here? I guess I'll just finish up with asymmetry, since we were just talking about that. Since we've talked about sweet spots for activation, we've been talking about kind of where we'd like to see EMG over the last few webinars. If you aren't aware, asymmetry in our software, a value of 1 or higher would indicate that component band is dominant in the hemisphere it should be. Of course, with alpha, we want alpha dominant in the right hemisphere. We want beta dominant in the left hemisphere. So we can see that this is 0.94, and that is because of what we're seeing here. We have more beta in the right side where we don't want it. So we should have a higher value here. So as you're training asymmetry, that's the whole goal, is we're trying to get power. If we're training beta asymmetry, we're trying to reduce the power here and add it back to the left side. And when you're training asymmetry, I would never want to just leave somebody here. So if I had been training them, let's say over the last 8 or 10 sessions, I was training alpha asymmetry, and this started more like this at maybe like a 0.95. If I got up to session 7 or 8 and I just hit this value of 1, and maybe beta was already a 1.1, I'm going to want to continue to train a little bit longer. Because leaving them here at a value of 1, brains can sometimes have a tendency to backslide a session or 2 when we move along. So I always want to consolidate their training. So I would consider this at the end of my acquisition phase. I've acquired the goal of getting the alpha dominant in the right hemisphere, but I don't want to just leave it here. I want to see maybe a 1.05. Ideally, if I can get them to a 1.1, that would be, perfect world situation. But I never want to just leave somebody right at the cusp, when I'm training them. I want to get them a little bit past, and that way I feel I've got a little bit more confidence that, I'm not going to see that asymmetry, switch back when we move to another location. So if this was my client, I would continue training a few more sessions. Now, mind you, if I hit a plateau, and let's say this was session 7, now I do 8, 9, and 10, and I'm still at a value of 1, that's probably where I'm going to stop there. If their brain isn't making a change within, the next 3 sessions, I've probably gone as far as it's going to go. I just can't push it. That's as far as the brain wanted to take it. It's technically good where it's at. We can see here, though, it's only a fraction of a microvolt higher on the right than it is on the left. So that's why I wouldn't want to just leave it right at a 1, because it's just barely there. So even getting this up, 1.05, that would put this at a 4.58, which would definitely be better than leaving them this close.
Yeah, I agree. Now, the other thing I would note on this particular, and again, folks, please keep in mind this is a simulation. We're not dealing with a human being attached, but that 0.94 beta asymmetry, one of the things to pay attention to, or at least I do, is notice that the high beta line, the dotted yellow line, stays constantly above the dotted pink line, which is your beta. So it might be that that muscle, if there's a bit of muscle tension that's pretty consistent, it may be just slightly pulling that beta up. Because when you look at the 2 pink lines, you can see where the beta does get down to the line, and it looks very similar like the alpha does. And then that high beta goes up a little bit on the right, and it pulls that beta up on the right. So I'm not too terribly concerned about somebody being stressed out at a 0.94 asymmetry beta when I'm seeing a pattern like that. So always just, check with your client to see how they're feeling. It might just be the muscle tensions making that slightly less than that 1.0 that you're shooting for, that Aaron's talking about.
Yes, I agree. Yeah, muscle tension, especially with beta, I see it day after day, when people ask questions, and that gets factored in quite a bit. Unfortunately, we can't put our clients in a catatonic state and get rid of all their muscle motions, but we can learn to look at our software and figure out if what we're seeing is accurate, Or like what Rob's saying, if it's more of a false positive, showing up because of something like an elevated high beta. All right. We are just about at the end. Any last questions? Anything anybody wants to ask? Feel free to unmute yourself.
Can you hear me?
Yes, I can.
I would love to ask Rob. He said something about will train a FZ and a CZ at the same time. Is that in the same session? You're doing a two
Yes,
lead?
it's one of the protocols that Daniel Amen put together when he was doing neurofeedback. You can train for people that, with attention and shifting tasks and so forth. At FZ, you can train up 15 to 20, and CZ, 13 to 15. But if the person has excessively high beta at FZ, then just train 13 to 15 up at FZ and 13 to 15 up at CZ. But try that protocol with people that have difficulty with attention and shifting focus. You might find it to be beneficial. But that's why I mentioned that, because I've used that protocol quite a bit and found it very helpful. But your asymmetry scores are not reflecting asymmetry. In reality, they're just numbers, because you're both of those are on the midline.
Right. Oh, okay. So
Does that help?
if they have high beta, then I would do
Typically,
both FC and
FZ
CZ.
15 to 20 up and CZ 13 to 15 up. But if the beta is excessively high in your map and you want to try that protocol and to maybe help calm that beta down, try training 13 to 15 up at FZ. See how that goes.
On CZ. Got it. Awesome.
All right.
Okay.
All right.
Yeah.
Good job, Aaron. Good stuff.
Okay. Excellent. All right.
Now, Wednesday, we're going to be covering photic, right?
Yes. Yep. I'm going to start off with a small slide presentation so we can all understand pathways of the optic nerves and how the photic travels. We'll get into photic sensitivities, because I think if you've never used photic in your clinic, you need to be well aware of all the possible things that can happen with photic. And then we can get into the software and actually talk about the different types of photic protocols we have available to us. What's going to be the more powerful, and then talk about how we can utilize the other ones when we need to. And then, of course, plenty of time to ask any questions you want. Like Dr. Suter mentioned, the last company I worked for, they were very heavily photic based. So I've dealt with using photic and talking about photic I've used photic now for about 13 years. Been training people for a lot of those years on it. So hopefully we can give you guys some good information, and Rob can even chime in with what he's seen with his clients.
Yep.
And let you guys ask whatever questions you'd like.
If you have questions, also feel free to submit them ahead of time so we make sure to cover the topics or questions you might have.
Yep, definitely. Please do.
All right. Good night, everybody. We'll see you Wednesday.
Good night, everyone. Thanks.
Bye-bye.